Chapter 9, Deficiency and Communicable Diseases. We will learn about what a disease is, types of diseases, deficiency diseases, communicable diseases, vaccination. Sometimes we feel weak and we get tired so quickly. It shows that we are unhealthy. Some parts of our body are not working properly and we are ailing with some disease. What is a disease? A disease is a state that stops our body to work properly. Types of diseases. The diseases can be broadly categorized as 1. Deficiency diseases. 2. Communicable diseases. Let us know more about the diseases. Deficiency diseases. There are millions of people who do not get enough food to eat, suffer from malnutrition. It is mainly due to the lack of vital nutrients in their diet, such as carbohydrates and vitamins. Definition. The diseases that are caused by lack of nutrients in our diet are known as deficiency diseases. These diseases do not spread from one person to another. Hence, they are called non-communicable diseases. Let us know about some of the deficiency diseases. Marasmus. It is caused due to lack of carbohydrates, proteins and fats. The child becomes so thin that loose folds of skin are visible. He or she should be given rice, wheat, nuts, honey, maize, fish, etc. Kwashiorkor. It is caused due to lack of proteins. The abdomen of the child gets swollen and bulges out. His or her legs become thin. He or she should be given eggs, fish, meat, cereals, pulses, etc. Knowledge hunter. Beriberi is a nutritional disorder that occurs when a person has a lack of vitamin B1. Anemia. Less hemoglobin produced in blood. It is caused due to lack of iron. Blood carries less oxygen in the body. The patient's body looks pale. He or she experiences loss of appetite and weight and feels tiredness. He or she should be given eggs, pulses, spinach, cereals, etc. Rickets. Lack of vitamin D is responsible for it. In this disease, we see bent legs and bending of the spine. He or she should be given milk, fish and eggs. Scurvy. Lack of vitamin C causes it. Here the patient experiences swelling and bleeding of the gums. He or she should be given citrus fruits such as lemon, tomatoes, oranges, etc. Night blindness. It is due to lack of vitamin A. The patient is unable to see in dim light. He or she should be given butter, carrot, milk, spinach and green vegetables. Improper growth of bones and teeth. Lack of calcium and phosphorus is responsible for it. In this disease, the bones and teeth become weak and brittle. The patient should be given milk, green vegetables, meat, fish, nuts, pulses, etc. Communicable diseases. The communicable diseases are also known as infectious diseases. They spread from a sick person to a healthy person through air by taking contaminated food and water, direct contact, insects bites, cut and injuries. Definition. The diseases that spread from one person to another are known as communicable diseases. They are caused by bacteria, viruses, fungi and protozoa. For example, diseases, germs. A. Cholera, pneumonia, tuberculosis, typhoid, plague, meningitis. Bacteria. B. Common cold, flu, polio, chickenpox, measles, AIDS. Viruses. C. Malaria, dysentery, protozoa. Mumps, cold and cough, hepatitis, malaria and tuberculosis are a few common communicable diseases. Let us know about the spread of the communicable diseases. Communicable diseases spread so fast that it may turn into epidemics, killing thousands of people in a short time. If not cured in time, let us know how this spread. Knowledge hunter Louis Pasteur discovered that the diseases are caused by germs. He was the first person to do so. Through contaminated food and water. Diarrhea, cholera, typhoid, jaundice, and food poisoning are caused due to consuming contaminated food and water. Flies, cockroaches, etc. are responsible for the contamination of food, and thereby people often fall sick. Through air. Many other diseases like chickenpox, diphtheria, whooping cough, influenza, smallpox, tuberculosis, etc. spread through speaking, laughing, spitting, sneezing, coughing, etc. Thus, the germs from the infected person come out in the air and pass on to a healthy person. Through contaminated soil. Very often, the soil gets contaminated by the eggs and larvae of tapeworms, hookworms, etc. They enter the body of a person through skin between his toes on walking barefooted on such soil. Through direct contact. Itch, ringworm, common cold, measles, etc. spread through direct contact or coming in contact with the objects used by the infected person, such as bed linens, handkerchiefs, clothes, towels, etc. Through insect bites and bite of other animals. Malaria, dengue, kala azar, plague, sleeping sickness, etc. are caused by insect bites or other animals' bite. In this process, they transfer the germs from a sick person to a healthy person. In this way, these insects or other animals act as carriers of diseases. For example, malaria is spread by a protozoan carried by a female Anopheles mosquito. Knowledge hunter. Malaria is caused by a parasite called Plasmodium, which is transmitted by the bite of the Anopheles mosquito. Through blood and body fluids. Communicable or infectious diseases can also be spread by coming in contact with the blood and body fluids of patients or infected person. When an infected person donates blood, the germs or infection remain in the blood and get transmitted to the person who needs transfusion. AIDS, acquired immunodeficiency syndrome, is spread in the same way, that is from infected needles or transfusion. Vaccination. Vaccines are made in small quantities of very weak germs of a particular disease. They are given orally or injected. When the medicine enters the body or body produces substances capable of fighting the germs of that particular disease. This strengthens immunity against a particular disease. Some of the common vaccines for the children are 1. Polio, OPV, to prevent polio. 2. DPT, to prevent diphtheria, pertussis and tetanus. 3. MMR, to prevent measles, mumps and rubella. 4. Hepatitis A and B vaccination. 5. COVID-19 vaccination. 6. Pneumococcal. Knowledge hunter. Dr. Edward Jenner, a British doctor, discovered the first vaccine against the smallpox in 1798. Due to this successful vaccine, smallpox has been wiped out from the world. Key words. Deficiency diseases. Diseases caused due to lack of a nutrient in our diet. Nutrients, vital substances present in our diet. Communicable diseases. Diseases that spread from a sick person to a healthy person. Germs, disease-causing microbes. Vaccine, a substance that is put into the blood to keep body safe from a disease. I should remember, a disease is a state that stops our body to work properly. Millions of people suffer from malnutrition. A disease caused due to lack of nutrients in our diet is called a deficiency disease. There are many deficiency diseases. A disease that spreads from one person to another is called communicable or infectious disease. Communicable diseases spread through air, direct contact, contaminated food and water, blood and body fluids, insect bites and bites of other animals, and through contaminated soil. Vaccine strengthens the immune system of our body against a particular disease.